Open heart surgery, what it is and how it is performed. Today we're going to talk about open heart surgery. We'll explain what open heart surgery is, why it is performed, and walk through how the procedure is carried out. Open heart surgery is a medical term used for any operation in which the surgeon opens the chest to perform surgery on the heart muscle, coronary arteries, or heart valves. It's important to understand that open heart surgery is not a single specific operation. Rather, it refers to a group of surgical procedures. The exact operation depends on the patient's heart condition and the problem that needs to be treated. Some of the most common conditions that require open heart surgery include coronary artery disease, blocked coronary arteries, repair or replacement of damaged heart valves, implantation of a pacemaker in certain cases, heart transplantation, replacing a diseased heart with a donor heart, many other complex heart conditions. Now, let's look at open heart surgery for coronary artery bypass grafting, CABG, one of the most common open heart procedures. The heart is a powerful muscular organ that pumps blood throughout the body. Like every other organ, the heart itself also needs a constant supply of oxygen and nutrients. This blood supply is provided by the coronary arteries, which run along the surface of the heart. Sometimes, these coronary arteries become narrowed or blocked due to the buildup of fatty deposits and cholesterol plaques. As a result, blood flow to part of the heart muscle is reduced or completely blocked. If blood supply is not restored quickly, that part of the heart muscle can become permanently damaged. When bypass surgery is required, the patient is first placed under general anesthesia. The surgeon then makes an incision from just below the collarbone down to the lower end of the sternum. The sternum is carefully divided in the middle to provide access to the heart. A special surgical retractor is used to gently separate the two halves of the breastbone, opening the chest cavity. Next, the surgeon opens the pericardium, the protective sac that surrounds the heart and the major blood vessels. This exposes the heart for the operation. Before creating the bypass, the surgeon harvests a healthy blood vessel, usually from the leg, great saphenous vein, or sometimes from the arm, to use as a graft. After identifying the blocked section of the coronary artery, the surgeon attaches one end of the graft before the blockage and the other end beyond the blockage. This creates a new pathway that allows blood to flow around the blocked artery and restore oxygen-rich blood to the heart muscle. Once the bypass graft is completed, the heart and surrounding tissues are returned to their normal position. The pericardium is closed, and one or more chest drainage tubes are placed to remove any blood or fluid that may collect after surgery. The breastbone is then brought back together and secured using strong surgical wires. Finally, the muscles, soft tissues, and skin are carefully closed with sutures, and the surgical wound is dressed. The incision is monitored, and the dressing is changed regularly during recovery. These are the essential steps involved in open heart bypass surgery and the basic concept behind how the procedure restores blood flow to the heart.